This program is brought to you by First National Bank of Botswana.
FNB, how can we help you?
The coronavirus, otherwise known as COVID-19, has practically shut the entire world down. Last week on the program, we reported on its effect on the global economy, which has been brought to its knees. At the time of recording this episode, there had been more than 18,000 deaths with more than 420,000 active cases, as reported by free reference website worldometers.info. Travel bans were imposed in Botswana and many other countries, coupled with temporary liquor trading regulations and postponement of various conferences, festivals, and other large gatherings. This crippled the local tourism and hospitality industries, entertainment and transport sectors. Although detrimental to the economy, all these were in efforts to curb the spread of the virus. During times like this, the use of hand sanitizers, soap and other disinfectants become instrumental to people's health. However, the Business Insider reports that there's been a shortage of sanitizers the world over. True to this report, our visit to various supermarkets and drug stores proved fruitless as hand sanitizer shelves were empty. It was to our discovery from floor assistants that as soon as new stock arrives, hand sanitizers fly off the shelves just as quickly. Governments have made efforts to provide sanitizers and soap at strategic places such as clinics, bus ranks and other places prone to crowding. While they understand the importance of sanitizing their fleets, some transport operators told First Issues they wish government made sanitizers and masks abundantly available to them, as they themselves cannot afford them. They retort this to government's call for public transport operators to not carry to capacity at this time as one of the measures to manage the spread of COVID-19. This has created a gap in the fight against this pandemic, which was realized by the DDT College of Medicine professionals who sought to be key players from the private sector during this war. The college has taken to producing sanitizers to provide to various institutions. The Chancellor at the college, Dr. Derek Clewer, says this has been part of their bigger picture approach to being more than just a learning institution.
We've got public health problems. Like right now, we have the coronavirus, which we see is a pandemic now. It is not classified as a pandemic. It means it's all over the world. We've been fortunate enough that it has not yet reached our borders. But out there aren't clinical sanitizers. There are simple things that you can do, washing your hands with soaps and having sanitizers. Right now, as I speak, DDT College of Medicine is manufacturing sanitizers in our labs that would kill the virus as well. Clean surfaces and antimicrobial soaps that will be able to break the virus if people wash their hands as they should. We released from our Department of Public Health a bulletin informing very early when this was coming, because we realized that this is an epidemic as it is, and if it comes here, we need to have a way of being able to protect ourselves. We do not as yet are able to test it, but we will be releasing those sanitizers and antimicrobial sprays and soaps very soon, should there be a need for the country, because really, even out there, we know what is happening. The shelves are empty for things that can be able to protect students.
The issue of sanitizer shortage has seen a mushrooming of individuals supplying the product in various sizes and forms on social media.
Corona, sanitizer, ra le sanitizer ra tlhabisa diata tang go reka bagolo le se ka la tswa ke mena huni e tetse mo social media ha dulana tsa ga nne ra le bolwetse batsadi ga nne ra ha le next
batho se thole ba taka kwano ka bontsi ya la jaaka re twetse since bolwetse bo bo simologang
weekend tete ke re tshwara tsa seili le te go tsama mpemphalo le ka low price lo khap
gona le bangwe ba ne ba re kwalla mo dipampiring re batla tsone di sanitizer mme ra di thoka go bangwe ba re ra ba re nya mme le ka dira yana go re hella re dira re yone sanitizer yone eo gore le rona re se ka ra salela ko morago.
It has come to our attention, however, that it is not all sanitizers that will work on the specific virus, as there are certain specifications that need to be adhered to in order for the sanitizer to be effective.
The first thing that we should be careful about when it comes to sanitizers is that we have to first understand or know the qualification of people who are producing them, because it's very important that sanitizers are produced by qualified pharmacists and scientists who should be ISO certified. Sanitizers are all over the country. They are claimant producers, but we have to be careful because a sanitizer must be able to deal with what is called vegetative microorganisms, which easily proliferate or multiply. Then a sanitizer must also deal with what is called microorganism spores, which are microorganisms that are very resistive to many of the household or common disinfectant solutions. So this is where we have to be careful, such that WHO has told us and has given out guidelines that sanitizers that are effective against most of these two types of microorganisms must contain 70% and above of an alcohol, either ethanol or 2-propanol. These are the key alcohols that are recommended by WHO.
So where does the college come in the production of these sanitizers, as the private sector jumping onto the bandwagon of helping government in this fight?
We heard of this coronavirus pandemonium in January. Then we have long planned then, such that our two departments of public health and the research and innovation product department met in January and decided to go for production of antimicrocidal hand sanitizers, antimicrocidal liquid hand soaps, herbal soaps. We also have what is called the top disinfectant concentrate that can be used to disinfect streets, government offices, schools, restaurant where a case has been picked or where a case came in contact with those places. So this is a key thing that the college decided to go into heavily, because we are trying to get ready, and obviously when we are ready, we are now in a position to help the country where there are shortages, so that we can somehow manage this pandemic, coronavirus pandemic, from becoming worse in our country.
When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Mohwebi Insurance. And when it means
how do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
Various campaigns on ways to reduce chances of contracting the virus have been doing the rounds on different electronic media, print and social media. But such information can never be shared enough.
Go itshireletsa go botoka go feta go ala ga bolwetse. Yaanong ke sone se re reng Batswana tswelela le ntse le thapa diata kgapetsa mo letsatsing, o thape ka metsi le molora. Go na le gone gore go diragale gore ga o leng teng, ga o kwa kgona nna le metsi le one mo lorao sanitizer le one e na le alcohol ya bo 70% e kgona go bolaya mogare. Pharologanyo ya go dirisa metsi le molora le sanitizer ke gore sanitizer yona o senola o itshasa e nna hela mo go wena ga o e thape. Go na le gape gore re nne re bua ka mo go teng ga o ntse go bapa le motho o mongwe bula phata mo go ntse go bidiwa go te social distancing mo re go utlwalelang mo ke gone gore motho o kgona gore a ethimole motho o kgona go gothola ra itse gore mathe a tsiriboga a tswa mo leganong la gago a kgona go goroga mo sefathogong sa motho o bapile le ene a tsena ka dinko a hema mogare o e be le gona ka o tsene mo mmeleng wa gago se tshware sefathogo sa gago ra itse mme bona tshego gore se atagela diata tsa rona tse di tshwara sele khantelo mphapena khantelo go fisi o tshwara desk ya gago a o itse gore a motho nang a go cleanela desk kana a e baakanya ho a ke motho e leng gore o nana le mogare wa corona.
A re boela ka ko kganya di sanitizer motho o ka itse jang gore sanitizer ya e dirisang ke e leng gore e na le alcohol eo e leng gore ya letelesega go ka bolaya mogare wa corona.
Rona re dirisa the international standard sa 70% alcohol e re itseng gore ha o e testa o e tsenya mo ha go na le megare teng e kgona go bolaya megare ene jaanong alcohol based sanitizer ha o e tshasagela mo saateng a ke re alcohol ke so se tsera mo phegong ha o hetsa o thela gore sa go se phaphaletse ga sa tshwana go sala se le metsi o bo itse gore ha o bo sala se le metsi e be gore sanitizer eo e thokana le alcohol ya teng ko tlase yaanong rona ra rena kona corona senke sepe se se pharologanye le se ntse o se dirisa disepa tse ntseng o di dirisa ka go harologana ga tsone di tabola mogare.
When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Mohwebi Insurance. And when it means
How do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
At the time of recording this episode, stores had already started experiencing an influx of customers who form long queues outside premises to manage the number of people inside at a time. Some service providers even started using the number management system, where a customer gets a queue number and waits to be called inside. While this worked for some, what happens to your time as a customer? And in the event movement is limited, what other options do you have to get your general supplies? Smart shopping is a concept that was devised for such times as this, where your health depends on whether or not you go outside. In recent years, we have seen various applications offer delivery services on groceries, food, and any other needs. Such include your Uber Eats, Amazon, and many others. Did you know we have services similar to those here? Albeit not so popular, but they do exist from pharmacies such as Link Notwane Pharmacy and grocers like Gabs Hyper.
Us as a Notwane Pharmacy, we have 2-3 channels by which you can order your medication, and we have extended that one for this corona pandemic because it's not advisable for all the patients. Mostly it's advisable only if it's necessary to come out of the home and get their medication.
What we're currently doing in light of the coronavirus, with the website being offline, we decided, well, we still have a payment gateway, so customers can still pay online using their debit or credit card. We just don't have a shopping cart from which they can choose products from.
We have a telephone service. They can order by telephone, then they can order online. We have an online site for Notwane Pharmacy, and then they can even send us WhatsApp, their picture, and then we have 2-3 options again. We can keep it ready. They can send someone to come and collect. Otherwise, we can send it to them at their home by a courier.
Customers can just mail us their requirements or grocery lists, and then we send them back a quotation, which they then approve. Once they approve that quotation, they can just click on a link, and that sends them to our payment platform.
We also, we are not only encouraging our patients, like when we counsel them, that it's not only the medication, they can use the other delivery services like online portal. They can even order their food from the restaurant online. They can send their laundry even they can order their cosmetics and other things. We encourage them to stay home and try to use these facilities which are available now in this modern era. They can shop online, at least for this, try to increase their shopping actually, especially in this pandemic of coronavirus.
We have also seen the establishment of a company called Batch Grocery Delivery Service, who use the WhatsApp Messenger and SMS to be personal shoppers. One of the founding partners of the company, Kgaleletsang Musweu, says all customers have to do is send them a list and tell them where to buy the items, and they deliver right at their doorstep.
Batch Grocery Delivery Services is a business that delivers groceries to your doorstep. What happens is, if you need for us to deliver to you, you're gonna text message us or WhatsApp. We have a WhatsApp number. You're gonna send a WhatsApp message to Batch Groceries, letting us know what you need and from which store and where you live, where you need us to do the groceries at. Yeah. So then after we've received that message, we let you know if we have someone that's available to do that for you, and if in how long they will do it, you know, and then we let you know of the charges that you are going to incur, looking at the kilometers from the store to your place of delivery. Yeah, so basically it's a service that is trying to bring convenience to Botswana, where you can just have your groceries come to you and you are just at home.
But tell me, these are not services that are very common in our country, you know. Convenience, as you put it, is not so much common here. So how did you come about realizing that gap and actually bringing that service here?
My business partner and I were lucky enough to live somewhere out of the country for a while. I was out of Botswana for 5 years. I lived in Europe, and in Europe is where you see people just receiving everything from the comfort of their own homes. People are buying clothes online, and the next day the clothes are at the door. You pick it up, you dress up, you go. You know, you don't need to leave your house. So that's where we saw people buying groceries online. People basically just buying everything online and having it delivered to their houses. So we just thought, why not try and bring that convenience here and see how well we can help Botswana and if they'll appreciate that kind of business.
So, Kgaleletsang, with this kind of business that involves money, there's always the issue of distrust and mistrust,
Of course, yeah.
So how did you make sure that people, or how do you make sure that people trust you with their money? It's not a scam, and you trust them for you to buy them these things and then get the money later?
The issue of trust. We try to deal with this business by approaching clients first as individuals, not as a business. I mean, from our side. We try and make sure that we're in constant communication with our clients. We try and make sure that we're updating them every time. When they send their money, we send the receipt that we have received the money, and now there's a shopper that is going out to the store to do the shopping for them. While we're in the store, we're constantly talking to them and letting them know what we can find and what we cannot find, just to keep it going, to show them that we're still with them and they don't like panic and think we've run away with their money. And then for us, on our side, to protect ourselves, at first we were using our money to do the shopping, but now we make sure to get the money from the buyers, and then we buy for them and then deliver.
During this pandemic, we're encouraged to stay away, right?
Yeah.
So how do you make sure that stay away because of the pandemic and, you know, the issue of transmission and contracting the virus?
Yeah.
How do you make sure that you're safe? Yeah, and your clients as
well? As much as we are told to stay away, you know, there's services that are called essential services. People still need to eat. People still need to go out to grocery stores, get their groceries. Nurses still need to work. They need food while they're working. They're at work. Doctors are at work the whole day, the whole night. Someone needs to be able to run around, get things for them for the house, so that at least when they get back home, they're good to go. So we are trying by all means to stay on the news, to follow what the government says, to follow the procedures, the measures put forth, all the precautions. We are using sanitizers, we are washing our hands, and then we're making sure also to not be in contact with our clients. When we do the deliveries, we make sure to just place our packages there, and then the client comes to pick it up. We try not to touch.
The coronavirus outbreak put the world to a shuddering halt through the element of surprise, threatening the very fiber of human existence. Its effects have been felt economically across the globe. While scientists work on a cure and a possible vaccine, let our individual efforts to curb the spread of the virus support that of our government. Be reminded to wash your hands frequently with soap, avoid unnecessary travel and contact, while also covering your mouth when sneezing and coughing. We have come to the end of tonight's episode. You've been watching First Issues. We hope you've been well informed. Good night.
This program was brought to you by First National Bank of Botswana.
FNB, how can we help you?